Hi, my name is Dr. Jay Bernstein. I want to talk to you about a window into U.S. healthcare and public health. And we're going to communicate a message through an example of a respiratory tract infection. And let's see here. So we're going to talk about basically the common cold, which we've all had probably many, many times in our lives. And in particular, we're going to focus on one called the RSV, the respiratory syncytial virus, just to start, just to give you some epidemiology, to understand the impact that this has on the amount of people it has an impact on. We could talk about a number of other viruses, which are listed here on the right-hand side, but we're just going to pick one out of many. And so according to the CDC, just the RSV alone, the respiratory syncytial virus, it results in 100,000 to 150,000 hospitalizations per year of older adults. That means over the age of 75. That's just one statistic. As I said, we could talk about many other viruses and add those numbers into it, but just want to give you a scope of just as a sort of thought experiment here. And then you add in the number of people that have lost work, which is going to be higher than the hospitalizations. Many people lose work that they don't go to the hospital, or they go to the ER and they don't get admitted to the hospital, but they lose work. And then just the aggravation of being sick, that's the numbers there are much higher. Just in other words, you go to work anyway, you tough it out, you go to school or work, you're sick, you have coughing, sore throat, nasal congestion, muscle aches, fevers. And then you add in the people who actually can die of RSV. There are people that die of RSV every year. 6 to 10,000 older adults die of a year. And then we didn't even talk about the infants, the children, other ages between childhood, say between the age of 8 and 75 years old. That's a whole other additional number to think about. Just think about the scope of what we're talking about. So you're going to say, okay, so what? Well, if a patient presents to the doctor's office or urgent care or emergency department with a viral infection, in other words, coughing, sneezing, those kind of symptoms, is the doctor trained to actually recommend a treatment that will resolve the infection more quickly? The answer is no. In other words, you're going to be treated, but it's not going to make the viral infection go away any faster. So if a patient presents to the doctor's office, urgent care, emergency department with a viral illness, do the providers always prescribe pharmaceuticals anyway, even though it's not going to make them better any faster? The answer is yes, always. And I'm just going to tell you now that for the level of charge goes up when a prescription is given. Think about that. So, and medicine is a business, despite what we want it to be. It is a business. So, is there a cure? In other words, the doctors don't have anything to offer. They'll prescribe various things, but for a viral illness, a viral respiratory tract illness, there's really nothing that the doctors can prescribe that's going to make you better any faster. But if I told you there's a cure, and in other words, something's going to resolve the infection more quickly, and even even prevent infections, then and I'm not talking about vaccines, by the way, and I told you that the same cure can actually prevent and possibly even be a cure for cancer. Would you believe that? You might not believe that, but let's take a look here. And what I'm going to do is I'm going to take you behind the curtains here. We're going to talk doctor talk, and we're going to start with a case. Doctors like to start with talking cases. So there's a case of a 24-year-old male. Okay, his name is John, who has no past medical problems, pretty healthy guy, who presents with 4 days duration, cough, nasal congestion, weakness, exhaustion. He doesn't want to exercise. He's feeling pretty crappy. He goes to his doctor, takes a day off on Monday, goes to his doctor. His doctor sees him, his primary care doctor, primary care physician. The primary care physician orders a influenza test, COVID test, RSV test, mycoplasma test, strep, all negative. He prescribes him pharmaceuticals to include Mucinex and ibuprofen and says, drink a lot of fluid, get a lot of rest, and return to the office if you're feeling worse. He gives him off till Friday. Friday comes along. The cough is worse because now he's coughing up green stuff, right? He's producing green sputum. So because he's producing some green sputum, he's coughing up green stuff. The doctor was a chest X-ray to see if there's pneumonia. It's negative. And tells me he's got a viral infection. He's going to have to run its course. He prescribed him now Tessalon pearls for the cough. He tells him it's Friday. If you're feeling worse over the weekend, go to the ER because, of course, the primary care doctor is not going to be available over the weekend. So on Sunday, he's not better. He wants to go back to work though, but he's feeling like he's just had enough of dealing with this, and he just doesn't know what to do. He wants to, other than the fact he's losing money, he wants to go back to work. So what does he do? On Sunday, he goes to the ER, and he waits in the waiting room for an hour and a half. He sees a board-certified emergency physician, the ER doctor, who now realizes this is his third visit. Said, we're going to have to do more testing here. So he orders blood work this time. He orders another chest X-ray because they don't share the same computer system, so we can't see the chest X-ray. The primary care doctor orders an outpatient. And then he orders some more swabs. This time he just orders an influenza and COVID test, both negative. He gives him a Z-Pack because the patient says, I think I need an antibiotic. So he gives him a Z-Pack, which is an antibiotic. He gives him an albuterol inhaler because he thought he heard a wheeze in his lung exam with a spacer. And he tells the file with his family doctor, and if he wants to go back to work, he'll write him a note to go back to work. So, okay, let's keep this case in mind for later. The case that I presented to you, the primary care doctor, the emergency medicine physician, they practice standard care clinical medicine. I have no reason to question their training or clinical practice. Remember the immense magnitude of feeling miserable, aggravated when you're sick, missed work, potential hospitalizations, and death. You think about all the people in the country that have these problems all the time. How many are there? There are many, many, many of them. So I'm just going to give you a new insight here. But utilizing the skills that I was given, I went to a medical school and got an MD. I went to a internship, excellent internship, excellent residency program. I've been practicing medicine for 25 years, and I've learned something. I've learned something that I was never taught, that I've derived from the scientific literature. So in other words, I use the skills that I have to investigate the actual published literature and coming up with a whole new paradigm of how to treat people, which is not being done by allopathic doctors or osteopathic doctors. We're going to start with an article that I found in the literature. I was sort of looking into the COVID vaccine, right? So I saw this article I heard about this article from Dr. Peter McCullough. It's called SARS-CoV-2 Vaccination and the Multi-Hit Hypothesis of Oncogenesis. What that means is that the COVID vaccine not only depresses people's immune system, but actually has, in multiple ways, increases the risk of cancer. And so I was fascinated by this article. It's an excellent article published in December 2023. And while I was sort of taking a deep dive into this article, I found, I started with one of the sections. If you notice, there are 7 different, it says cancer progression in the center here. There's 7 different boxes, okay, that each one of them is a section in the article where it actually, if you understand how, if you read through the section, it describes from the literature, all evidence-based from literature showing that this COVID vaccine causes cancer. So the first one I started with is this one because IFN is interferon. Well, I know about interferon. A lot of these this really hard science is there's so much happening on a regular basis that most doctors, you learn what you learn in medical school and residency maybe, and you basically use those tools to try to figure out what's going on. But there's a lot of advancements. So there are a lot of new concepts that you have to keep learning. And so I just started with one there. Interferon has been around for a long time. In other words, we've known about interferon. Interferon is a cytokine, something it's part of your immune system, but we've known about this for a long time. So because interferon is a very powerful part of the immune system I'm aware of, I went down the rabbit hole of looking into the section first on interferon. And it talked about the toll-like receptors. Those weren't around when I was, training. But this is the interferon mechanism goes through this toll-like receptor. And so what happens is when this vaccine is given to people, your interferon alpha is decreased, right? So, interferon, just to give you an idea of how the importance of this cytokine. We can synthesize it in the lab, and it's sold, for a treatment. So in other words, you can give IV interferon. You're basically replacing a part of someone's immune system by IV, and interferon alpha costs about $11,000 a treatment. Interferon beta is about $12,000 a treat. I'm sorry, $22,000 a treatment. And even though it's about 10 to 20x markup in the hospital, that's what the hospital would charge. So maybe it's for interferon alpha, maybe it's about $1,000 the cost. So, but either way, it's expensive. It's an expensive drug. It's a very powerful drug. It can actually cure hepatitis B, hepatitis C. Both of those were thought at one time to be permanent. They are generally permanent without treatment. Once a person gets hepatitis B or C, you get that from blood transfusion, IV drug abuse, sexual transmission, and those are permanent. So they're serious, but interferon can actually cure those, because what you're doing is you're enhancing somebody's immune system, right? Interferon is given for different cancers, which we'll talk about, and some other chronic illnesses. So I asked myself, what can I do to increase my own natural interferon? Well, before I get there, before I answer that question, I want to just point out that this so far, I mean, maybe you're really believing what I'm telling you here. Is this fake news? Does a vaccine really increase the risk of cancer? And I want to point out that this article, these are the reference pages. There are 255 references from the scientific literature published in PubMed, the scientific database, which is the basis of all scientific and medical understanding and treatment. Everything's published in the scientific database. So this has got 255 references. It's very well referenced, very well done, well written, and all the claims are backed up by science. So let's go back to interferon. I think I've actually, before I sort of answered the question I was asking about how to increase my natural interferon, I want to just give you a little bit more information of the importance of interferon still. There was a 2022 paper. This is the picture of the paper that had that basically was a review of 194 articles in the literature showing interferon can reduce viral count reduce the severity of many respiratory illnesses, duration of many viral illnesses, so in addition to what I already told you, and this is just some of the table just summarizing some of the articles it discusses. It can, as I said, it can cure hepatitis B or C, which are permanent. It can also decrease the severity and the duration of all these viruses that they checked: influenza A, influenza B, parainfluenza, and adenovirus, rhinovirus. And these are the outcomes in the studies. This one prevents it. This is preventative. This has had efficacy against RSV, respiratory syncytial virus, that we talked about. This one showed an improvement for COVID in this rhinovirus. So this is just a sample. Interferon also decreases cancer. It's FDA approved for a number of cancers, and it's FDA approved for melanoma. It's usually given after they fail chemotherapy, because chemotherapy is a standard treatment. So they give interferon if it had reduced tumor burden, a number of different outcomes. In melanoma, interferon alpha reduces the tumor, inhibits tumor growth here. Here's another. These are all different studies, and these are kind of the summarizing the findings. When they give interferon alpha, this decreases tumors. This study looked at colorectal cancer, given interferon alpha, suppressed tumors. called another colorectal cancer, interferon alpha, suppressed the outgrowth of those tumors in that study. Again, this is just a sampling of the article. And then it goes on, there's more interferon alpha. Then there's interferon beta. Then they go into just a number of studies showing interferon beta helps, right? So, and this is another article published in the data showing the mechanisms of how it does that. So I'm just going to point out one, two, three, four. One study shows, or some studies, each one of these categories is representing one or more studies showing because tumor cell apoptosis, which means just cell death. The angiogenesis means growth of the blood vessels. The tumor needs blood vessels. It decreases the blood vessels to the tumor. That helps decrease the tumor. This is another mechanism that it decreases tumor adhesion. The cells of the tumor, the cell-to-cell adhesions were disrupted, and that disrupts the progression or growth of the cancer as well. This one looked at the immune response of our natural immunity that goes against the cancer cells. And then this one here dysregulates the cellular energy of the tumor. So those are just some mechanisms. Now, this is not just theory. There's a lot of evidence showing how it works. And interferon, many cancers have improved outcomes with interferon, as we said, which only a handful are FDA approved for interferon. In other words, what cancers are FDA approved, and generally they're given after they fail chemotherapy. These are the four cancers that are FDA approved: malignant melanoma, hairy cell cancer, Kaposi sarcoma, which that's we get in AIDS, chronic myeloid leukemia, which is a blood cancer. So I'm going back to the question I asked earlier: what can I do to naturally increase my own body interferon? Well, when I first looked it up, lo and behold, a study published in 2007 shows garlic, and this is fresh garlic, by the way, not cooked garlic. You destroy a lot of the goodies in the garlic. So this article showed that the natural interferon levels, interferon alpha, in people increased from 9.5 to 46.3 in 1 week. They took 2 grams of garlic a day for 1 week, and this group of people increased on average interferon levels went basically almost 5 times higher. This is from the same article, which looked at interferon alpha and also looked at nitric oxide. Nitric oxide is also very, very beneficial. And by the way, garlic also increases interferon beta. But this just looked at these two, and I'm only going to talk about interferon alpha because I don't want to get too confusing here. So when you consume basically different levels of garlic, and then you check the interferon levels 4 hours after you eat the garlic. So probably the because it's hard to eat 2 grams is about 2 to 3 cloves. 4 grams is going to be double that. So it's hard to eat raw garlic. It's hard. So let's just say if you increase your interferon from 9.5 to 50 in 4 hours, that's probably your sweet spot in terms of like, you're not quite maximizing it. In other words, the benefit gets a little bit more, but it's not double. So I would say 2 grams might be a good dose to take. So increasing from 9.5 to 50 in 4 hours, the same article. In the same article, Allium sativum is the Latin name for garlic. Now, this side of the graph looks at interferon alpha. This one looks at nitric oxide, and what we're looking at is the dotted line. This is over. We said 4 hours because it went from here to all the way up here, and basically in 2 hours you get most of the benefit, and then it goes up a little bit in 4 hours. And what happens over time, it's going to sort of go down after that period of time. So this one looked at 2 grams one time and see what happened with the over a few days. In other words, it's the levels. This is just a short term, and then you carry it through the whole day. You wind up with a level of about 20, and then the second day after you take 2 grams one day. 2 days later, it's still going up at a gradual pace, and then sort of maxes out at about 2 days. And then it goes down. So if you take the garlic every 2 days, you'll have your maximum amount. And most likely what happens is it went up and then the steady state came down because as we saw over here, this this went up to here in 4 hours, and then they just sort of carried it out. And then day by, they took data points each day. So, just want to sort of emphasize this point here that, going from 9.5 to 46 is a 4 almost a 5 times increase in 1 week. And think how cheap garlic is compared to, interferon alpha. If it's given IV, it's, thousands of dollars. Not only that, anytime, there's many paradigms we could talk about, but we don't have time in this video. But there are many different paradigms where if your body increases something naturally, in other words, it increases naturally by the garlic, you're increasing your own production of interferon. It's much better than given IV. A, it works better, more effectively, and B, less side effects. So we're going to talk now about something called free radical oxidation. And what causes that are these molecules called reactive oxygen species, ROS. So, and that's any sort of damage that's done to the body, whether it's cancer, chronic disease, acute disease, always winds up producing reactive oxygen species. So this free radical oxidation is not good. This is very destructive in our body. So cellular injury results from ROS, reactive oxygen species. So, and then when you have excess reactive oxygen species, that causes because you have cellular injury, you have weaker immunity because you have immune cells that get weaker. This increases susceptibility to infection and has oncogenicity because, which means causes cancer, because our immune system actually is very effective in preventing cancer. That's our immune system not only fights infection, it fights cancer cells that are trying to or cells that are trying to become cancerous. Your immune system keeps those in check. So what do we have to neutralize the ROS, the reactive oxygen species? We have in our body, we have something called reactive sulfur species. Those are the antioxidants in our body. And the reactive sulfur species, as I said, neutralizes the reactive oxygen species. And the most abundant one we have in our body is glutathione, GSH. That's the most abundant reactive sulfur species. So when reactive oxygen species are neutralized by a reactive sulfur species, this results in cellular repair. And immune systems that undergo repair by glutathione, the reactive sulfur species, has the ability it basically enables your body to neutralize infection and also neutralize cancer, because these cells are healthier and therefore the immune cells are healthy, and they're able to do the job more effectively. This is just from an article in the literature showing that they call it a redox ratio. In other words, the glutathione GSH to its reduced state GSSG. In other words, when you use up your GSH, when it's doing its job, it then gets converted here into this. So there's a ratio. If a cell has this to this ratio, a GSH to GSSG ratio of greater than 100 to 1, that's a healthy cell. If the cell has a ratio of GSH to GSSG of, say, 10 to 1, that's a very unhealthy cell, and that cell is prone to even malfunction or die. So the GSH, the glutathione, it goes to the mitochondria, and that's a lot of things go on in there. The energy of the cell takes place there. The nucleus, which is where the DNA is, that's the control center of the cell, or the endoplasmic reticulum. It helps repairing mechanisms in all three of these places. And the GSH also can leave the cell, and it can go into the outside of the cell and cause some improvement in the cytoplasm outside the cell, and in various ways that help other cells maybe. Okay. This is just from another article from the literature showing this ratio: the GSH, the GSSG, the glutathione greater than 101 is good. When it's low, these little signals here are not working well. They're not being released as much. And these two, IL-1 beta, interleukin 8, these things help the neutrophils, which this is a white blood cell, helps it migrate where it needs to go towards whatever it's going to be neutralizing, like an infection, for example, right? So it's not going to migrate as well if this ratio was low. Same thing here. This is called the macrophage. This low ratio, it doesn't do its job, is to engulf things in the, particles in the body that shouldn't be there, and it communicates with something called a natural killer cell. This communication is weakened. Interleukin 12 is not released as much or not functioning as well, and interferon gamma is not working well. So this communication is not going well. Therefore, it has a lower it has a lower ability to do its job through the reactive oxygen species. Okay, so there's this is from another article in the literature, and this is in all these numbers are just other articles. Basically, it's kind of a review article reviewing other articles in literature, looking at how do we increase our GSH levels, our glutathione levels, which is really important, as we talked about. Well, one way is the diet. This is okay. One way is there's all different articles showing your various things in the diet can actually improve your glutathione. And this is another article showing the number of ways in nutrition is the way we just talked about. Also, we synthesize glutathione from these 3 amino acids, glutamine, glycine, and cysteine. Together, it makes this glutathione. That's how we manufacture it. Also, it can be recycled from the regeneration from this ratio GSSG to when it gets oxidized again, and then turns into GSH. So that's how there are 3 main ways we increase our glutathione. Well, it just so happens that same garlic we looked at that increased the interferon also increases glutathione. This is a graph from cell culture. This is data from cell culture that shows that over time, these cells, these skin cells are basically release glutathione based on increasing the allicin, which is a component in garlic, can have it enables it to release the glutathione. So the glutathione is released from these cells when you inject 15 micrograms of allicin, and it goes up to, say, this is the number of hours, so about 24 hours roughly, it's producing glutathione after it gets this allicin. And they got this number from this graph here because the maximum effectiveness of the allicin is the 15 micrograms. So they used this in this study and showed that it peaks out at about 24 hours, and then until it can get another dose. This over here, this bar graph over here on the right, shows when you give these cells 15 micrograms of allicin, which is again part of the garlic, every other day, you can maintain the levels. The black is the levels of the black is the levels of glutathione, but you're giving the allicin every other day. Okay, this day, 2 days later, 2 days later, 2 days later, each 15 micrograms, and you maintain these levels up to 10 days. And the bar graph without the color is the cells that didn't get any allicin or no garlic, and there was and the glutathione levels remain lower. Okay. So if we take a supplement that increases a person's glutathione level, then what can happen? Can you increase that way? Well, I'm just going to give you sort of this paradigm that we know, this in emergency medicine toxicology. We all know this, and this is just as an example to understand a little bit of this the impact of this supplement called N-acetylcysteine. In this scenario, in this article, what happens is if a person takes acetaminophen, which is Tylenol, right? Normally, what happens is 5 to 10% of it goes into this molecule here called NAPQI. It causes cell death, and in order to get rid of that, we need glutathione. Glutathione will get rid of that NAPQI, and then you'll excrete it in the urine. right? 90, say 85 to 90% of the Tylenol in the liver just gets converted to these other molecules that just get excreted in the urine. Okay, fine. This, I guess 5% goes directly out into the kidney and you excrete that in the urine as well. The problem is that you have an overdose. Somebody takes so much Tylenol, it can overwhelm your glutathione levels, your natural glutathione levels, right? So then what happens is you get a lot of this stuff, this NAPQI, okay, that's the bad guy, and that causes that can actually shut down your whole liver if you take enough Tylenol. I'm not going to tell you how much. I don't want to give anybody any ideas. But if a person takes so much Tylenol, you shut down your liver, that can cause death. And it may take weeks to months to die, but it would be a slow, miserable death. But if it's not treated, then how do we treat it? We treat it with this N-acetylcysteine. It's a supplement, actually, you can get over the counter. But we give it nowadays IV. And we can actually, as a result of the N-acetylcysteine, it converts into glutathione. We replace the glutathione, and then we can actually save somebody's life. It's basically considered the antidote for Tylenol overdose as long as it's given within 8 hours. So what exactly is in garlic that increases the interferon and the glutathione, like we talked about, these two amazing molecules? Well, this is the breakdown of what happens inside the garlic. The garlic comes with this molecule here called allicin. And then it comes with this enzyme called allinase. They're in two separate compartments in the garlic. When you chew the garlic, again, not cooked, raw garlic, you chew it, these mix together and it forms this molecule here. This molecule times two of these down here, when you remove the water, your body remove the water molecule from it, you get this thing called allicin. Allicin is that one that causes a really strong taste and smell. And this allicin then goes into 13 more molecules, depending on how long you leave it around. Like, for example, if you put it in some raw honey, it can convert, depends on how you do it. If you just put in the cloves into the honey, it'll take a week and a half to 2 weeks for these molecules to form. If you want to crush it up, which kickstarts that reaction, it may take a few days or even less, a day or two, to produce these molecules in the honey, and then you just eat the honey. You don't even need to eat the garlic. So all these molecules here, these are all immune stimulants, all of them. These are very good for your immune system, and it can increase your glutathione and your interferon. Well, so after learning about this from the literature, not from my training, not from my continuing medical education, and nobody's practicing in MD medicine. I'm like, how long has this been known for? Like, I was blown away when I was going down this rabbit hole. Okay, so the first article I found was in 1944. This is the article here showing that garlic is as antibacterial as penicillin was in 1944. This is an article showing it used the same assay, the same test that penicillin would kill bacteria. The garlic was equal as effective. Interesting, huh? Now, it happens to be in this article, this is the full page of the article, I noticed something. And you look in the upper right, which says summary, right? There's a little a summary on something called DES, diethylstilbestrol. Well, I know about that. All medical students know about that, and all doctors know about that. We all learned it in medical school. It was a molecule synthesized in a lab. It was a estrogen-like molecule, like the female hormone. So because of that, it was like estrogen. The doctors, the scientists theorized without any proof. They just theorized it would prevent miscarriages. So it was marketed because they got a patent on it. Okay, they got a patent on this drug, DES. Okay, and it was marketed to prevent miscarriages. Happens to be because it would cause a very, very, very unique vaginal cancer in the daughters of the mothers who took it. How are you going to figure that out, right? Well, the reason why is because it's extremely rare, almost never happens otherwise, and it was such a strong carcinogenic. It had such a strong carcinogenic effect that it was the world of medicine, the powers that be at the time, figured it out, at least by this 1970s. So it was taken off the market in the 1970s because it caused this very unusual, very strong likelihood of getting this vaginal cancer. In the daughters who took DES, they took it during the pregnancy, and the mothers took it during the pregnancy to prevent a miscarriage, which never worked for a miscarriage. That was a false claim. And not only that, it actually, there's some literature now showing it caused many other cancers as well. So that was taken off the market. We all know about that. It's like a historical thing. All medical students learn. But we didn't learn anything that garlic helps anybody. You know why? Because you can't get a patent on it. Okay. So why? So the question is two questions. Why do most allopathic doctors, osteopathic doctors, nurse practitioners, PA, not prescribe garlic? Why only pharmaceuticals that don't cure anyone? Why are we giving pharmaceuticals that don't cure? Mucinex, Tylenol, ibuprofen, you get, this, that, and the other thing. You're giving antibiotics for viral infections, which, the question, that's the question. And I'm going to leave it with the question. I'm not sure I'm going to answer the question. I'll let you think about an answer, but let's go back to the case. Case presentation. Let's analyze it. Remember John, 24-year-old, previously healthy male, had a cough, nasal congestion, weak, tired, didn't want to exercise, right? Miserable. He's miserable, right? He's one of those many millions of Americans get miserable when they get these viral infections. Monday, the cost was for all that he did, $1,500. Goes back, he misses a week of work too, by the way. Friday goes back, $250 for that visit, okay? He goes to the ER, over $3,000 in that visit. Okay, we're not even counting if he actually followed up his family doctor after the ER told him to follow up, right? Okay, so the total cost. On Monday I included his lost the amount of the visit was $450. I included the amount he would be losing for lost work. So he added that all up. The cost is almost $5,000, and the aggravation of being sick, and he's not going to get better any faster from what he was treated with. So the question is, why are medical school training absent of this information? Why is it not in continuing medical education for doctors? Why is it not expected for people who are board certified in various practices that might be able to practice this way? Why is it not standard practice in medicine? How did we get here? That is the question. How did we get here? And I'm going to leave you with that. In the meanwhile, garlic is a lot cheaper than $4,870, right? If you took garlic, because of the interferon alpha. By the way, we didn't talk about interferon beta, which also is immune stimulant. We didn't talk about the nitric oxide, but those also add to his immune enhancement. But he would have gotten better quicker with a lot of garlic, and he would have gotten back to work faster. He'd be less aggravated. And yep. So that's it.